Hello, thank you everyone for your participation and feedback over the last week of this debate. Today I'm going to summarize why older adults should be able to age in place. The aging population is growing, and with that comes chronic diseases and disabilities, putting burden on the healthcare system and long-term cares. Aging in place means to have the health and social supports and services you need to live safely and independently in your home. Think about where you want to live as you age. Is it the same place you've lived for 30 years or more, or is it to move to a new, unfamiliar environment? If you answered the first, you are not alone. Over 85% of Canadians want to age in place. And honoring patient choice is an important healthcare trend. Therefore, older adults should be able to age in place. Aging in place promotes and maintains quality of life. Sixsmith and their partners found older adults felt their home kept them physically, socially, and mentally healthy. And research has found that people who have lived in their home longer and are attached to their environment have a higher quality of life. Although it is difficult to find the exact numbers, research has shown it is cost-effective for both the individual and the healthcare system to age in place. And a classmate pointed out the effects of moving and transitions can be burdensome and cause depression in the older adult. For these reasons, older adults should be able to age in place. My opponent pointed out some arguments to aging in place, but these can be mitigated by planning ahead and appropriate policies and legislation by governments. My opponent stated that older adults who live at home tend to neglect themselves, but this is a complex issue, and people can neglect themselves in long-term care by refusing care. Social isolation is a risk with aging in place, but Wittman, Score, and Kalaya found that older adults were socially isolated if they felt there was no accessible services to them. And there are already programs that combat social isolation for older adults living at the home. Unmet needs is another argument against aging in place. The Government of Canada estimates 36% of people had unmet or partially met needs, but that means more than half, or 63% of people, had their needs met. My opponent stated that needs go unmet because of the cost, but there are programs and support to mitigate this, such as tax credits and grant programs. Perhaps the biggest argument against aging in place is the heavy burden that it may put on family members or caregivers. But should that cost be shifted totally from caregivers to taxpayers? Is it our responsibility to care for our loved ones or the government? In other cultures, it is the expectation to care for the elderly. What healthcare systems need to do is care for the caregiver, and there are already programs and services that help support financial and emotional burden caregivers face. My opponent stated that elder abuse occurs in the home, but it can happen anywhere. In 2016, it was estimated that 1 in 6 elders were abused in long-term care in Ontario. Because of the benefits of aging in place and being able to mitigate the arguments, we need to support aging in place. Reina stated that we need to reform our approach to caring for the aging population by bringing care closer to where they live, where it costs less to deliver and do more good.